I had originally planned to do this for 10 minutes, so mine's going to be a little bit faster than 15. Um, I am doing my research was on the male factor. The male factor is uh, a term that I found in my research. And what I ended up doing was contemporary acupuncture related techniques for male infertility. Originally, I wanted to study sexuality and acupuncture points that were helpful for libido. My original work um, was for women with low libido. And during that research, I found that there was very little information in English on anything having to do with libido, especially with males. So when I took on this project, I realized I would need to change my tack and work with infertility. And even then, I found that the research that's available is very small, very limited in English. And since I don't speak Chinese, that was my only possibility. So uh, my original desire uh, was to work with libido, and I ended up working uh, with things like sperm parameters. So what I wanted to talk about today is actually you can see on the infographic here erectile problems, varicocele, semen alterations, low sex drive, small testicles are some of the manifestations of that men have with infertility. But the etiology has more to do with lifestyle, diet, stress, and also environmental factors and genetic factors. The actual sperm parameters that the research that I used brought up in actually three different studies were things like reduced sperm motility, progressive motility, which is the forward motion of the sperm into the vagina, into the uterus, uh, low sperm count, semen volume, sperm concentration, morphology, the shape and the the form of the sperm, and semen non-liquefaction, which is something I'll talk about a little bit later. There are also some other factors that have to do with the seminal plasma, the uh, enzymes and proteins within the semen that were studied. The first of three randomized controlled trials that I studied had to do with transcutaneous electrical acupuncture point stimulation. And what they were studying there was particular parameters, sperm parameters, as well as the molecular mechanisms inside the sperm plasma. This study had four groups. The T's 2 hertz, T's 100 hertz, mock stimulation of T's, which is where they were actually not using acupuncture points. They were non-acupuncture points on the body. And then also lifestyle advice. So it was four different groups. What the acupuncture points that they used were bladder 23, stomach 26, Hui Yin, Ren 1, and Ren 4. And in that study, there were a lot of exclusion criteria. So men who had ejaculatory dysfunction, a medical history of infertility, immune-related infertility problems, hormone therapy treatments, infections, genetic diseases, occupational exposure to agents, and people that didn't return after the first treatment. The results in all of these studies were positive. In this case, the patients in the first group, the 2 Hertz Ts, responded the best to the therapy. They had significant changes in all of the sperm parameters, and there were also good results from the 100 Hertz. The next RCT that I studied was a study of acupuncture versus varicocelectomy. Right, so varicocele, for those that don't know, you can see there in the picture, is some veins within the testicles that have morphed and become pathological. In this study, they were studying, again, sperm parameters. There were 2 groups: acupuncture treatment twice a week for 2 months, the first group, and the second group was subinguinal microscopic varicocelectomy. And the inclusion criteria for this study was that all men had to have unilateral varicocele. So that meant that there were a lot of exclusion criteria here. The acupoints used were Ren 3, Ren 4, Ren 6, bladder 23, bladder 32, and stomach 29, with electrostimulation. And again, the results were good, with a significant increase in sperm concentration and motility in both groups, and a significantly higher increase in the acupuncture group compared to the varicocelectomy group. And the third of the 3 studies that I researched was probably the most interesting. This was what you're seeing now is the slide for the first group. And the objective here was to study actual sperm non-liquefaction, which is when a man ejaculates, the semen is usually liquid, but in some cases the semen is actually solid. And so what they were studying is they wanted to find out if acupuncture can help to liquefy the sperm at room temperature in at least 30 minutes. The 2 groups, again, this is the control group that you're seeing. So clarithromycin tablets, which is a low-grade antibiotic, a hip bath with Chinese medicine granules, herbal granules, prostate massage, and transurethral microwave treatment. I would just have to say that these men must really have wanted to become pregnant, because they receive this treatment 2 to 3 times a week for 8 weeks. You can see here the electrode goes in through the urethra, stays in the bladder. There's a balloon catheter there, and it's supposed to destroy extra material. The second group was the treatment group. And so this group received the same comprehensive treatment as the control group, with the addition of a Gushen plaster, which is 23 Chinese herbs. And the effective rate was determined by 3 different statuses. Recovered meant that the couple got pregnant and the sperm liquefied within 30 minutes. Effective was that the couple didn't get pregnant, but the sperm still liquefied. Markedly effective was less less liquefaction, and ineffective was no significant results. The treatment group here received the best indications, and the pregnancy rates were highest in the treatment group. And so these are the three studies that I did. There were some important limitations. Mainly it was the size of the studies. They were all small. The varicocele study needed more information on the plasma proteins. The T study required more information, more study in the variability of the pulse stimulation. Somewhere between 2 and 100, there might be other pulse stimulations that are beneficial. And for the REN4 plaster study, it requires a better design control group, because in effect, there were actually 2 treatment groups there. These are my references, and the first 3 are the studies themselves. The fourth one, the last one there, is a book that I highly recommend that goes into the male factor with regard to Chinese medicine, both traditional Chinese medicine and classical Chinese medicine. And I spoke to this woman on the phone. She's fantastically intelligent and well-read about this. And here are the rest of the references. Thanks for your time, and let me know if you have any questions.
Yes, since we are on time, if you want to have one question, we can have it before moving to the next. So anyone? Seems